I'm Craig LeMoult. Tonight on Greater Boston, as dozens of Haitian migrants land in Massachusetts, fleeing violence and instability back home. Many have taken shelter at a local hospital, while city and state officials struggle to find a place for them to stay. Why is it so hard to find housing for these refugees? We'll discuss ahead. Then the mayor of Cambridge on the launch of the city's first in the nation guaranteed income program, set to give all families with children under a certain income threshold $500 a month, no strings attached. In recent days, the lobby at Boston Medical Center has been home not just to patients waiting to see a doctor, but to dozens of Haitian migrants in need of somewhere to stay. Refugees from Haiti have been arriving at the hospital since the fall of 2021. But officials with BMC report the number of homeless refugees seeking shelter there has risen dramatically in recent weeks as the country, which humanitarian groups say is on the brink of civil war, faces escalating gang violence, food and job shortages, and barriers to accessing medical care. BMC has been scrambling to provide these migrants with food, shelter, and other basic needs, along with city and state officials and advocacy groups, including the Immigrant Family Services Institute. Officials have been able to find places to stay for many migrants who have come to the hospital, but with more people fleeing Haiti every day, the struggle to find shelter continues, as does the strain on the hospital. I'm joined now by that executive director of the Immigrant Family Services Institute, Dr. Geralde Gabeau, and Jeff Thielman, president and CEO of the International Institute of New England, which supports immigrants and refugees in the region. Thank you both so much for joining us.
Thank you.
Thank you.
Dr. Gabeau, can we start with you? Can you describe for us the situation in Haiti right now, and what is it that people are fleeing there?
So basically, right now, the situation is impossible for people to live in Haiti with gang violence and interruption at all levels. Basically, there is a lack of leadership. Government cannot do anything. The country is run by gangs, and people cannot go to schools. You know, they cannot go to their job. Even access to hospital to care is impossible. And that's one of the reasons why I continue to say, as long as the situation persists the way it is in Haiti, we have to be ready to welcome them, because they don't have any other choice than to leave, because the situation is definitely in dire right now.
Well, Jeff, it sounds like we're not ready to greet them. What are the challenges that these migrants are facing when they're getting here to Boston?
Well, the challenges are many. First of all, the big challenge, as Dr. Gabeau said, is to find housing. The challenge is to help them find jobs if they're eligible for jobs. A big challenge for many people is they're paroled into the country for a short period of time. In some cases, their status is iffy, and so getting them employer authorization documents is something our organization does in partnership with Dr. Gabeau's organization. We enroll people in public benefits, health care here in Massachusetts, cash assistance, which is offered by the federal government to certain people in certain statuses. We enroll them in food stamps. We enroll them in transitional assistance. So we do what we can to help them get started in the Commonwealth of Massachusetts, and then we also will help them find jobs if they're eligible to work.
Well, why are they winding up in the emergency room?
There's no other place for them to go. So everybody's situation and story is a little bit different. Some of the stories we're hearing is that they arrive here, they've got a friend in Boston or in the Boston area, they might stay with them for a day or two, or they might get there and there's no place for them to go, and so they go to Boston Medical Center and then they stay there. You have to understand, Boston or Eastern Massachusetts has the third largest concentration of Haitians outside of Haiti. Largest is Miami, second largest is New York, we're in third place. Lots of people want to come here. They know there are jobs here, they know there are good schools here, and they have friends and family here, or people they may know or know of, and so they want to come to this area.
Dr. Gabeau, I understand, are some of these migrants winding up at your office as well? I understand that some of them are staying there. What's it been like there?
So, I mean, since last year, we've been the entry point for new migrants. Whenever they arrive from the airport, basically they come directly to our office. So last year, when we had the same crisis at Boston Medical Center, we were very involved in making sure that we talk to landlord, and then we even sign up a list on our own name to to place family in housing. And we have a large network of friends, of churches. We always try to find a solution, but we reach a point where without resources, it's impossible for us to continue like this. And that's the reason why it's heavy on us, because we have so much to do with Solelo. And that's the reason why we hear a lot about the crisis. But last year, because we were able to intervene and quickly, we didn't feel that the heat the same way. So that's where we are calling on everyone to step up, because we need to be ready. We cannot turn our back toward those who are fleeing, difficult conditions and come here to find it worse than what they left behind. So that's one of the reasons why I'm calling on everyone. Let's step up. Let's do it. We can do it, and we should do it.
And I understand that the migrants who were at Boston Medical Center they've found homes for those who were sleeping there. But as you said, we're not done with this, right? This is going to continue. There are more people coming. You're asking people to step up. Are they doing it? What do you need them to do in order to step up?
So first, we need to step the federal government to act in terms of providing resources to state, to cities, and to organizations like us, so that we can find the resources to do the work that we are doing. We are also asking people to open up their hearts and their homes, because we saw with different groups, a lot of people did step up. They did help other groups who are here, in terms of providing housing. People have a spare room, they have a basement. They open up their hearts to people. But we find it a little bit more challenging when it comes to the Haitians. We don't feel the same level of enthusiasm, the same level of people wanting to step up to help. And that's the reason why we said we need to step up, because, again, those are human beings fleeing really difficult situation. They are here and they want to contribute to their community. They want to help. So the least we can do is to provide them with the housing that they need, so that they can go work, contribute to the community, help themselves, and help our community.
Yeah, I mean, we've heard a lot of talk about Ukrainian refugees, and there was some extraordinary steps that were taken to welcome Ukrainian refugees into this country. Are you seeing a notable difference between how these groups are being treated?
Yeah, it's a world of difference in terms of the way that Haitian migrants are being treated compared to other groups. Again, we are open, we want to help everyone, but when we see this magnitude of difference between the way Haitians are treated compared to other groups, it hurts us. It pains us to see that when we're talking about systemic racism in this country, it goes so far even to close our doors to the less fortunate among us, and that's a shame. That's a shame for our country. And I said we need to do better.
Jeff, have you seen other groups of migrants that are dealing with the same kind of challenges, or is this unique?
Yes, so we have about 5,000 total people in services right now at the International Institute of New England. That includes Afghans who fought by the side of American soldiers in the war in Afghanistan, Ukrainians who fled the conflict in Ukraine, and we have 2,030 Haitians, many of them referred by IFSI, by Dr. Gabeau's group, to our organization in services right now. And the difference in funding available to Ukrainians, between Ukrainians, Afghans, and Haitians is significant. So the Haitians are not getting the same sort of federal assistance that Ukrainians got or that Afghans got. I will say this, the state legislature in Massachusetts passed a bill last year that funded something called the Massachusetts Resettlement Service Program, a support program, MRSP. And those funds are for Ukrainians and other displaced populations. So the International Institute and other resettlement providers in the state, we are using that funding to help Haitians. We're using state funding to help Haitians. We need more federal funding to help Haitians. And Dr. Gabeau is 100% correct. They are not getting the same support. And the important thing to recognize is that this state lost 110,000 people since the start of the pandemic. Now we have people coming into the state of Massachusetts who are fleeing a humanitarian crisis, but every single one of them that I meet, every adult that I meet, wants to work. They want to work. They want to get into the workforce. They want to make some money. They're willing to work 1 job, 2 jobs, 3 jobs. They're willing to take jobs that no one else wants right now. And so we need these people. We should be not only embracing them from a humanitarian perspective, but excited about them being here because we've lost population and we need people to join our Commonwealth.
But isn't there a barrier, a ban on them actually working, and that's something that could potentially change?
It depends on their legal status. So if they're paroled into the country, they can get an employer authorization document. We have assigned one attorney on our staff to work with Haitians to get them employer authorization documents as fast as possible. It can take a couple of months. It just depends on the circumstances of their status. So if they get an employer authorization document, they can get into the economy and get a job and make some money. Another challenge that folks face, whether they're from Ukraine or Afghanistan or Haiti or any other country, is learning English. We have English classes, but we have huge waiting lists for our English classes. All groups that do this kind of work need more funding from the state of Massachusetts to offer more English classes to people that want to come here, work, and contribute.
Okay. To a point that both of you made about federal assistance, Boston Mayor Michelle Wu's office put out a statement that read in part, the city and state need the federal government to provide the necessary support to deal with this crisis by increasing their capacity to issue work permits to asylum seekers, providing additional funding to provide support services throughout a community-centered approach, better coordinating with states and cities on anticipated arrivals, and establishing clear protocols for the Department of Homeland Security personnel to return all documents to migrants upon release. Dr. Gabeau, can you speak to that, about the need for the federal government here to step in?
Exactly. First, it takes months and sometimes a full year for someone who apply for work authorization to receive it. And that's the reason why the burden on us is heavier. Because when you are helping someone for a couple of months, hoping that they will receive their work authorization and they don't, it means that you have to spend more time, providing for them, when in fact, there is a way for work authorization to be coming out quickly. They did that for the Afghan. They did it for the Ukrainian. Some of them received their work authorization in less than a week. Our people are waiting a year to get work authorization. That's one of the reasons why the federal government needs to step up to at least release those work authorization to allow people to go to work. And from the border, so often we find people coming with no documents or with confusing documents. We have people who come with 1 day of parole or 1 week of parole. So all of those confusion, and sometimes they hold documents from people, which means that by the time that they are in our community, they cannot do much because they need those documents. So those are all of the things that the mayor is referring to in terms of working in collaboration with both city, state, and also community-based organization. So we have a comprehensive approach toward welcoming our brothers and sisters.
Okay. Jeff, in just the minute we have left here, what can regular people watching this do? Is there anything they can do to help with this?
Well, I think Dr. Gabeau said it. One, they can contribute to either one of our organizations or any organization working with Haitians. Two, if they have places for people to live, if they have an extra home and extra room in their house, if they have a part of their house they're not using, they should contact one of our organizations because people need places to live. They can contribute food, they can contribute clothing, they can volunteer for English classes. There's a lot of things that people can do to help out. And they can also advocate. So it's really important. We've had a lot of success and a lot of outpouring of support for Afghans and Ukrainians, well-deserved, no doubt about it. But also they can advocate to the legislators, to Congress, to our leaders that Haitians need support. Haitians bring a lot of potential to this state. And we want these people to come and stay and be part of the Commonwealth.
Okay.
Exactly. And time, they can contribute their time because so often they are here, they need to go to the hospital, they need to access, services. People can come and help. Like this Saturday, we have a day of service with, a number of people coming to help us so that we can serve those people. We are bringing all the people from the shelter for a day of service to help them so they can come and help.
Great. Well, we have to leave it there. Dr. Geralde Gabeau and Jeff Thielman, thank you both so much for joining us tonight.
Thank you so much.
Thank you.
A pleasure. Thank you.
Next, starting June 1st, low-income families with kids in Cambridge can start to apply to get $500 a month, no strings attached. It's through the city's new guaranteed income program called Rise Up Cambridge. It's a dramatic expansion of a pilot program the city tried out back in 2021 with 130 single parents. The new program includes all families with children in Cambridge making 250% of the federal poverty line or less. The program's expected to help around 2,000 families and to run for a total of 18 months. Earlier today, Cambridge's mayor announced the launch date for applications and says the city plans to start sending out checks in July. Mayor Sumbul Siddiqui joins me now, along with Saadia Van Winkle, the communications advisor for Mayors for a Guaranteed Income, which funded the city's initial 2021 pilot program. Thank you both so much for joining us.
Happy to be here.
Thanks for having us.
Can we start with you, Mayor? Tell us what this program's going to be, how it's going to work, and why you wanted to do this.
You know, the why is really simple for me. I think cash is such an effective tool to help those in poverty. And we saw with Cambridge Rise how meaningful it was to families who said this is making a difference for their kids, their mental health. And so for us, expanding it made a lot of sense so we could help more families. And for me personally, I grew up in Cambridge, grew up low income, saw my parents working 3-4 jobs constantly. And I saw how hard it was for them to make ends meet. And so I hear from these families daily. And so this is something that, is a great way for the government to say, we see you, we hear you, we trust you, and we're going to let you use the money the way you see fit.
Saadia, guaranteed income programs do exist around the country. How many are there? Even with that, though, this is a unique program, right?
Yes, absolutely. So we, through Mayors for a Guaranteed Income, have more than 45 pilots all over the country, ranging from cities as large as Los Angeles to ones that are more mid-sized like Cambridge to smaller cities like Madison, Wisconsin. And this is the first one, though, to be expanded to every family in the city that needs it. And every time, without fail, when we have one of these programs launch, despite the circumstances, despite whether it's an urban area, a suburban area, a Midwestern area, Eastern Seaboard, whatever it may be, there are always thousands and thousands of people who do not qualify, and there are only so many spots. When this is philanthropically funded, there are only 100 or so, possible openings for people. So the ability to be able to expand it to people who are hurting the most, who are the most vulnerable in a city, is a first in the entire country, and we really hope is laying the foundation for what we hope to see in the future, which is federal action.
Because all other programs were done with lotteries, right? This is a non-lottery program. It's anybody who meets that requirement.
Exactly. So anyone who's eligible, they can submit an application and then they would be receiving money.
Okay. And the reason you can do this is because of funding from ARPA, right? The American Rescue Plan Act. Speak to me about the importance of that federal funding and how it kind of made this possible.
Yeah, ARPA money, Federal Rescue Plan money, just was key to this, right? It was put into place to help families recover from the ongoing effects of the pandemic. And now we know there's record high inflation, everything costs more. So it's been a great program for us to utilize. And we're using $22 million of our ARPA money. So it's a big chunk of our ARPA money.
And you're doing this based on building upon a pilot that you mentioned a moment ago. Can you speak to me about that pilot, how that worked, and what did you find? What difference did it make in people's lives?
Yeah, Cambridge Rise was our 18-month pilot. It ended in February, and it was $500 monthly. And we partnered with Mayors for Guaranteed Income, our Cambridge Community Foundation, and a host of nonprofits. And that went directly to 130 single caretakers. And these caretakers have just mentioned amazing stories, right? We have Lida, who talked today about the fact that she used the money to pay for mental health counseling for her and her daughter. She didn't have to wait for those long insurance through insurance. That's something that she did. We have other recipients who are using it to pay back debt, other recipients who are paying for camp, for childcare. These are basic necessities that our families are using the money on, and they've said it's just been really useful, really impactful.
I had a chance to speak with several of the participants in that program for a story that I did about this. One of them told me that she had dealt with chronic pain for years, and that she felt that the lifting of the stress that she had, financial stress that she had, actually impacted how she felt physically. That she no longer had as much issue with the chronic pain. Is that something, the kind of thing that you've heard in other cities, that the impact goes beyond just, being able to pay bills?
Absolutely. I mean, I think that's honestly one of the most important impacts. And I think really when we're talking about guaranteed income, of course, it's an economic policy. But what I wish we talked more about were really the intangible benefits. How are you strengthening a community? How are you strengthening its residents? And taking off that toxic stress, which truly is toxic, research shows that, is immeasurable, that is invaluable, right? So we have anecdotally heard that all over the country, and we have actually found through research that that is true as well. We just got the results of the Stockton pilot that is what led to the founding of Mayors for a Guaranteed Income, and consistently throughout the 2 years of that study and beyond getting the payments, people reported having improvements in their physical health, in their mental health, less economic volatility. And I interview people all over the country who have been parts of these programs, and they all say the same thing. They say, I'm able to breathe, I'm able to sleep. People talk about being able to spend more time with their kids, to be able to show up better as parents, because they're so stressed out thinking about, am I going to be able to cover groceries this month? Am I also going to be able to pay for the rent? And when you have that, just that small buffer of $500, it's not enough to pay all of your bills, but it is enough to not be terrified that if your car breaks down, you're going to be out on the street. And that is a huge sense of relief for people.
Yeah. You mentioned Stockton, that's Stockton, California, which is the largest study of this kind of program to date, right?
So far, it is. We have larger studies happening across the country. We have data that will be coming online in the next 6 months to a year, from St. Paul to Los Angeles City to Cook County, Chicago. So we have a lot more studies coming. But I do want to mention that we've already seen this at scale. We had the expanded child tax credit, which many of your audience members probably received because almost every parent in America received it. And we saw those results. It cut child poverty nearly in half. And when it was expired, child poverty shot up by more than 40%. So those are huge numbers, and that was unrestricted cash. That was guaranteed income given to nearly every parent in America, and it made a huge difference. And research showed that parents spent it, as Mayor Siddiqui said, on the essentials, on being able to cover their bills, on being able to put gas in the tank. Lita spoke about that this morning, saying the stress of not driving to work on an empty tank and instead just having it half empty, it's still not full, it's just half empty. Yeah. But that is the difference between somebody being able to sleep at night and not.
Mayor, I think we're certainly going to hear from some people who say that government just giving people money without any restrictions is irresponsible, and that's not how government money should be used, especially since there's no guarantee of how that money is actually going to be spent. How would you react to a criticism like that?
You know, I think I'd say that I think government's role is to trust families. And I think we've seen time and time and again, and we've seen in the research that our families are spending money on basic necessities. And so, you know, I think there are always going to be skeptics, but I think, you know, I really see the role of government as helping people. And I think you don't help them by, you know, thinking that not trusting them and not using dignity, right? You know, we are using this program as a way to say, look, there should be more dignity in this process. We don't have to control every little thing. We see the social safety net, all the applications, all the various barriers, right? We make it really hard for people to be poor in this country. And I think government should make people's lives better.
It's 18 months. It's funded by ARPA for now. ARPA is a one-shot deal, right? That funding is going away. We're not going to have that 18 months from now. Do you see a future for this kind of program in Cambridge? And if so, how could it be funded?
Yeah, we're committed in the city to continue to support our families. I think we are looking at ways locally on how to do that long term. We also need state and federal partnership and leadership. And as Saadia mentioned, the CTC, we want that to come back, right? It's not an either or. So I think as a society, there is plenty of money to be helping everyone and doing programs like this. But you're right, we do need a bigger concerted effort. It can't just be Cambridge locally.
Well, isn't there also a state law that actually prevents Cambridge and other cities from using operating funds to give directly to residents? Is that a barrier?
Yeah, Massachusetts has something called the Anti-Aid Amendment, and looking at that, that is something that we're trying to figure out how we work through that, because as has been mentioned, places like LA, you know, they can use the general fund. They don't have the same rules. So that is something to explore with our state partners.
How do other places fund this kind of thing?
A lot of it is through philanthropic dollars. A lot of it right now is through ARPA funding as well. Many cities have a mix of it, but again, ultimately, we need it to be at the federal level because the reality is this is a bipartisan situation, but pretty much all of our mayors are Democrats, and we need people in Republican-led cities to also have relief. You know, as Mayor Siddiqui said, people are paying more and getting less. People are working hard and they're not able to join unions. They're not able to buy homes. They're not even able to go to their kids' soccer games. So I think it's really about figuring out what we value as a society. And as a country, we have a long history of finding the money to pay for the things that we find important. So if we want to be a country where we believe that child poverty is immoral and abolish it, we can do that. It's just a set of choices. So we could just make a different set of choices than what we are choosing right now, which is to benefit the wealthy and allow them to spend their money however they want. Nobody is going to their homes and asking them how they're spending their giant tax breaks, right? So until we're going to Jeff Bezos's door and knocking on it and asking him what he's doing to help society, I think that these questions of, you know, how are people going to spend their money, which, as Mayor Siddiqui said, people are spending it on their basic necessities. Less than 1% is spent on vices such as alcohol or tobacco. I think that's really the kind of society we want, where it is based in trust and based on how we want to be treated and treating our neighbors like that.
Mayor, Cambridge is such an interesting city because it has this huge tax base, all of these, you know, big businesses and tech and pharma, but it also has a very wealthy population. It's a very expensive city to live in, but there is a sizable low-income population. As you said, like roughly 2,000 people, 2,000 families are going to be served by this. I mean, do you think Cambridge is a good example of a place that could really benefit from this, and where is it more possible to do this in Cambridge than maybe some other cities? Yeah,
I think cities in generally are, you know, laboratories for democracy. Cities can be innovative, and so I think Cambridge is at the forefront of that. And I think if you look at Cambridge, it is a tale of two cities, as you mentioned. We have people who are making annually $13,000 a year to people who are making $400K a year. And so I think something like this definitely will benefit some of our lower income families who, you know, day to day, they are struggling, right? And we hear about that. The mayor's office, we hear about people who are having such a hard time after, not only before the pandemic, but it's been further exacerbated by the pandemic and what we're seeing in society.
Well, Cambridge Mayor Sumbul, Siddiqui, and Saadia von Winkle, thank you both so much for joining us and coming in today.
Thanks for
Thank you.
That's it for tonight. We'll be back tomorrow with a Harvard professor rallying against efforts to sanitize African-American history in AP classes. Plus, one of the employees suing famous Boston chef Barbara Lynch for abuse and harassment. That's tomorrow at 7. Thanks for watching. I'm Craig LeMoult. Good night.
I think art has a way